History taking in obstetrics. The first component of history in the patient of obstetric is biodata. First of all, you will ask about the name of the patient, then the age of the patient, then where she came from, then married for how many years, wife of, that is her husband's name. Then the three particular things which you are to have to mention in a patient who comes in obstetrics is the last menstrual period, the expected delivery date, and the gestational amenorrhea. That is, she has a, like you will mention that she has a gestational amenorrhea of how many weeks. The next component is to note down the presenting complaints of the patient and whatever they are. And the third component is the history of presenting illness. In the history of presenting illness in the patient of OBS, if the patient is pregnant, you always have to ask these particular questions. First of all, whether the pregnancy was planned or unplanned, whether it was spontaneous or an assisted pregnancy, or how did the patient confirm the pregnancy by urine test, blood test, on ultrasound. How did she confirm? Then you have to ask about the intake of vitamins. Then if she had come about after 24 weeks or late in the first trimester, then you have to ask about the fetal quickening, whether she feels the fetal quickening or not. And if she has come in the 7th or 8th month, that is in 28 to 32 weeks, then you also have to ask about the immunization status of the patient. There are two shots of tetanus which are to be given to every pregnant lady, so you have to ask about those. And any history of an abnormal vaginal discharge, you also have to ask about that. The next thing is the menstrual history. In the menstrual history, there are 5 components. You have to ask about the age of menarche, the duration, that for how many days it occurs, and a very important question is the question that whether the cycle is regular or irregular. Then last menstrual period, and if she is this you don't have to ask in a patient of obstetric who is pregnant. Obviously she will not be having menopause, but in an older patient in gynae, you have to ask about the age of menopause. The next component is past obstetric history. In the past obstetric history, you have to give a detailed information of all the previous pregnancies of the patient, how many pregnancies have occurred, how many babies she had, and how many of them are alive, how many of them died, how they died. If there have abortions occurred in the past, then you have to mention them. How did they occur, whether they were spontaneous or they occurred in the hospital, were there any complications before and after the procedure, all that. You have to give a detailed past obstetric history. So what are the components of this past obstetric history? First you will ask about all the previous pregnancies, their gender, whether they were male or female. Then after how many years of marriage the first pregnancy occurred, after the first pregnancy, how many years after the second pregnancy. In this way you have to mention the years, the duration of each. Then you must mention the gestational age of each of them, that is at how many months each of them were born, whether they completed their gestation age, whether they were at term or preterm or post. You have to mention that. Then mode of delivery, whether these were normal deliveries, SVDs, C-sections, whatever the mode of delivery was. Then you have to mention the birth weight, whether they were of normal birth weight or they were low birth or small for gestation age, anything. You have to mention that. Then about the complications, whether the patient felt any partum complications, any intrapartum or postpartum complications, you have to mention that. Then about the immunization status and breastfeeding of the patient. And lastly, you have to mention that at present what is the age of each of the children and what is their mental and physical state now. Then there is cervical and contraceptive history. In cervical and contraceptive history, you have to ask one question in each. In the cervical history, you will ask whether she has undergone a pap smear or not, and in contraceptive history, you will ask about any contraceptive measures patient used in the past or currently or is going to use, about that. And then there is past medical and surgical history. In the past medical and surgical history, you will ask for any medicine she is taking, any illness she had in the past, any reason due to which she was admitted in the hospital, any accident she met in the past, or about these medical and surgical conditions. In the family history, you will ask about certain things about the family history of ischemic heart disease, diabetes mellitus, hypertension, or any other anomaly. In the socioeconomic, you will roughly ask about the kind of house in which the patient is living, the family members, the aeration, the water supply, the bread earner of the patient, and so that you can roughly know about the socioeconomic status of the patient. Next, you have to ask about the drug history. In drug history, you will ask whether the patient is taking any drugs, whether she had any drug allergies, that's it. And in the personal history, you will ask about any addictions, tobacco, smoking, or any kind of addiction. And that's it. Just briefly touching the examination, in case you are given a long case and you have to mention the examination findings along with the history. You will first mention the findings of general physical examination, whether the patient was, you will briefly describe the patient, that the patient is normal, healthy looking, sitting or lying comfortably on the bed, and well oriented in time, place, and person, conscious, cooperative. And then you will tell about the findings on general physical examination, that if there is a pallor, cyanosis, koilonychia, anything. Then you will comment on accessible lymph nodes, whether the accessible lymph nodes were palpable or not. Similarly, thyroid was palpable or not. This is a general physical examination. After that, you will mention the vitals, that consist of blood pressure, respiratory rate, pulse, and temperature. You will comment on that. And lastly, you will comment on your findings of per abdominal examination, and you will be done. This is a sample history. It's not a complete one. It is just mentioning the points which are very particular about the obstetric history. For example, in biodata, how will you include all those points we mentioned in the biodata? Patient ABC, wife of Mr. XYZ, 31 years old, housewife, married for 6 years, resident of satellite town Rawalpindi, gravida 3, para 2, with 2 alive issues, with an LMP of this, an expected delivery date of this, presented through OPD on 29 January 2018 for routine antenatal checkup with presenting complaints of, and you will mention the presenting complaint if there are any, and if there are not, then you will mention simply pregnancy. History of presenting illness. Patient presented with a gestational amenorrhea of 32 weeks. Pregnancy was planned, spontaneous, confirmed via urine test at home. She took multivitamins throughout the gestation. She feels fetal quickening and has been given 2 tetanus shots and has no abnormal vaginal discharge. Then you will briefly comment about her signs and symptoms or any complaints in the first and second trimester, and whether she undergone her bleeding scan in the first trimester and anomaly scan in the second trimester or not. So you will mention she remained normal throughout first and second trimester, has her dating and anomaly scan done at 8 and 20 week of gestation respectively, and the rest of the history is same. If you are running short of the time and you have to cover a whole lot of syllabus and you want to quickly grasp what precisely you need to know about the topic, or you hate to read the textbook again and again, or you have to do a quick revision of a topic just before exam, then continue your journey with this channel by clicking the subscribe button below. Thanks for watching.